it affects the tissues in the vulva and in the vagina. And so where that tissue may have been thick and plump, now it decreases in basically like those the cells, right? They shrink, and what happens is that you have decreased blood flow to the vulvar region. You have a decreased lubrication. You can start to have overactive bladder. You can start to get recurrent UTIs, and of course, you can have pain with sex. And so, to make sure that that doesn't happen, we advise that women use vaginal estrogen. And that vaginal estrogen is going to recruit all those blood vessels in the pelvis, in that vulvar region. And when you increase that blood flow, you're going to have increased lubrication. That tissue is going to plump up again. And, something that happens in menopause is that the labia minora start to shrink. And so, really important, and they eventually go away. And so, what's really important is to use that vaginal estrogen on the inside of the vagina. Make sure that you rub it in, but also on the outside of the vulva, the labia minora, even to put a little bit on that urethra and on the clitoris, because what you're trying to do is increase that blood flow, and you're trying to keep the anatomy as it is so that it doesn't shrink. And what happens also is that as we go into menopause, that urethra starts to get bigger as well, and because that vaginal microbiome changes, you're also at risk for increased bladder infections. And when that urethra increases, you're at a higher risk of bladder infections. So really important to make sure that you're using that vaginal estrogen. Even in breast cancer patients, there was a study that was done and they followed them. It was a Swedish study and it was over 49,000 women, and they followed them over the course of 5 years. And they noted that those women that used the vaginal estrogen had no recurrence of their breast cancer.